And so then I started saying there's something wrong here, because I see this pattern where people have no radiographic arthritis at all, but they have horrible joint pain. Or on the other hand, you have horrible radiographs with no pain. So what's the difference and what separates the two? And so then I had to start looking at it a lot differently because it didn't make sense. And so then I started saying, well, the people that don't have any radiographic arthritis, let's stay away from gluten and dairy because we know that those are inflammatory in some way. And so I just started treating them with diet and saying, remove this from your diet and see what happens. And I've had a handful of patients that do that, and they'll come back 6 weeks later that are religious to actually doing that and removing that from their diet. And they'll come back 6 weeks later and they're like, I have no joint pain whatsoever. So then I started to look at food as being an inflammatory problem. The food system in our country is very poor, and a lot of people will just eat processed food, and they've made us believe that a calorie is a calorie, and that's certainly not the case. When you look at the nutrition science and you actually dive into the nutrition science, you realize that food is medicine, and you can dial in whatever physiology you want with different vitamins, different minerals, anything.